I want to talk about some factors that should be included in retirement planning and your dental health. These are things that you may or may not have thought about, but I thought we would summarize them briefly in this video, and then in future videos go into more detail on the individual points. When it comes to planning for your teeth in your retirement years, here's some things to consider. As we age, we often start taking new medications, and those medications often have interactions to other medications we're taking. One of the main side effects of that is dry mouth. And so we see in a lot of adult patients that they start to have problems with their root surfaces, with either decay or some other issues that can happen with dry mouth, such as burning mouth syndrome or dry tongue, that kind of thing. There's things that can be done to prevent those, and if we address it early on, it can be very inexpensive and very preventative. Which brings me to the next point. Preventative dentistry becomes even more important in these years. A lot of times people start doing more things like traveling, visiting relatives, grandchildren, as they enter their retirement years. And so it's very easy to overlook regular dental checkups. Now, a lot of adults who've been on every 6 months during their working years will benefit from being moved to every 3 or 4 months in their retirement years because of the other issues that I just mentioned. And again, the importance of catching those issues early. So as somebody's moving into their retirement years, we need to be proactive about scheduling and looking ahead to appointments that work within your new schedule as you're visiting all those grandkids. And so Judy, my treatment coordinator, is very savvy about working with our patients who may be spending 6 months in Arizona and 6 months in Seattle. And so those things are very important to make sure that you're working with a treatment coordinator who understands your travel schedule and will make sure to accommodate you and keep you on those regular checkups. Some other things as you're looking forward to retirement are to think about things like COBRA and treatment planning needed dental care before you actually retire. We've found that if a patient gives us a heads up of 12 or 18 months before their actual retirement date, we can do a full assessment of their dental health and look for things that might potentially be a problem out 3 or 4 years. And maybe we'll make a plan to be more proactive to address those things before they hit the retirement age. That way they're taking care of more expensive dentistry when their income is also more flexible. The last thing I want to mention with looking ahead at retirement is that with dental health, there's some things that we can do to help keep teeth healthy while you're traveling. A lot of new devices and tools have come available on the market in the last couple of years that are wonderful for people who are snowbirding to southern warmer climates. So our hygiene team is very well versed and can do an oral hygiene assessment for any patient at any time to help them match tools to dental problems that we're seeing in their mouth. And all of this is with the goal of having our teeth well into our golden years. It's very possible today for all of our patients to never lose another tooth. So if I can be of any help or anybody has any questions, please don't hesitate to post those. Thank you.